Hey guys, I am Mandy Norris and I am doing my presentation over housing in correspondence with Chapter 16. On any given night, there are approximately 2,397 people experiencing homelessness. 50% of them are in shelters, 24% are transitional, and 26 are unsheltered living on the streets. In the 2021 to 2022 Kansas school year, districts reported 7,129 students who were either doubled up, living in shelters, unsheltered, or living in motels. I found these numbers very sad coming from my home state. It really puts into perspective that these are people in our backyard and we don't even realize it. Kansans who are homeless may be so as a result of high cost of housing, limited income, unexpected expenses and medical debt, physical or behavioral health needs, domestic violence, or it could be a combination of any of them. According to the textbook, some characteristics of the homeless population are race. 1 in 69 minorities entering shelters are African Americans. Geographic spread, rural homelessness. The rural homeless tend to live in cars, double up, or live in grossly substandard housing. Frequency, 37% are part of a family and 67% are individuals. Families, usually headed by a single woman in her late 20s, generally has at least one or more children under the age of 6. Unaccompanied youth, young people leaving home due to severe conflict, individual adults often having mental illness or substance abuse, and veterans, which this population is actually declining in Kansas. Kansas is seeing an increase in homelessness, especially unsheltered. As social workers, we may be faced with helping those without permanent housing or children of parents in this situation. As social workers, we must advocate for every category of homeless, as well as legislation for better policies. I will discuss a few policies that are in place now. The first policy is a housing choice voucher. It is determined by family size and composition. The choice of housing is placed in the hands of the individuals or families, and they are given several options to choose from to see which one is the best fit. They can choose from single-family homes, townhouses, or apartments. And these units are not limited to subsidized housing projects. It is a federal program for assisting very low-income families, elderly or disabled, to afford decent, safe, and sanitary housing in the private sector. These vouchers are administered by local public housing agencies, or PHAs, who receive federal funds from the U.S. Department of Housing and Urban Development, also known as HUD. We generally know this program as HUD or Section 8 housing. HVCs help around 2.3 million people a year. So the housing unit that is selected by the PHA for the family or individual must meet an acceptable level of health and safety in order to be approved. Once the family or individual finds a dwelling in which they choose to live and reach an agreement with the landlord over the lease terms, the PHA must inspect and determine that the rent requested is reasonable. So every time that they find one, the PHA goes in and has to inspect it. The PHA determines a payment standard. That is the amount generally needed to rent a moderately priced living unit in the local housing market, and that is used to calculate the amount of housing assistance a family will receive. However, the payment standard does not limit or affect the amount of rent a landlord may charge or the family may pay. So when it is time to pay when it's time to pay rent, the housing subsidy is paid directly to the landlord by the PHA on behalf of the renter. And then the tenant then pays the difference between what the actual rent is and what is covered by the subsidy. If a renter is unable to afford more of their own payment, then they may actually use their voucher to purchase a home. They can use that voucher towards purchasing a home if they're able to afford that. A family that receives a housing voucher can select a unit with a rent that is below or above the payment standard. The housing voucher family must pay 30% of its monthly adjusted gross income for rent and utilities. If the rent is greater than the payment standard, the family is required to pay the additional amount. So whatever is left over after the subsidy, the family has to pay. When a family moves to a new unit where the rent exceeds the payment standard, the family cannot pay more than 40% of its adjusted monthly income for rent. Eligibility is determined by the PHA based on the total annual gross income of the renter and is limited to U.S. citizens and specified categories of non-citizens who have eligible immigration status. So generally, the tenant's income cannot exceed 50% of the median income for the county in which they live, and by law, a PHA must provide 70% of its vouchers to applicants whose income do not exceed 30% of the area median income. The median incomes are published by HUD and vary by location, and sometimes they vary drastically from one place to another. Some issues with this is that landlords may end up charging more than the family or individual can actually pay, even after the subsidy. There are long wait lists, which create problems for those that are needing housing. The PHAs may actually establish local preferences for selecting applicants from its waiting list according to particular needs. So, like, they may give preference to homeless people or people living in, like, seriously substandard housing, people that are paying more than 50% of their income on rent, people who are involuntarily displaced. Another issue is the number of landlords is falling in participation due to the National Housing Quality Standard and its complementary inspection and enforcement regime. So it is reported that 4 out of 100 very low income central city and 2 out of 100 suburban very low income suburban renters live in severely inadequate units. So the number is fairly low, and by requiring every unit be inspected, it takes a lot of time. Also, this can extend housing search periods. There are declining voucher holder success rates. A few things we could do to fix this problem is a coordinated, expanded investment in behavioral, mental, and physical health issues, food and childcare supports. We could reduce property taxes. We could build more multi-unit, low-income housing. Another program I'm covering is project-based vouchers. Project-based vouchers are a component of the PHA's Housing Choice Voucher Program. It was enacted in 1998 under the Quality Housing and Work Responsibility Act. Its latest statutory changes were enacted by the Housing Opportunity through the Modernization Act of 2016. So project-based voucher units are managed by HUD. The PHA uses its tenant-based voucher funding to allocate project-based units, but it does not receive additional funding for these. Projects are typically selected through a competitive process managed by the PHA, but not always. A PHA is allowed to use up to 20% of its authorized voucher units to project-based units in a specific project if the owner agrees to either rehabilitate or construct the units, or the owner agrees to set aside a portion of the units in an existing development. Like the Housing Choice Vouchers, project-based vouchers, tenants usually pay about 30% of their adjusted gross income towards rent. The landlord gets the rest of the rent from the local housing authority. This program differs from the Housing Choice Vouchers in that when applicants are approved, they must agree to live in a specific unit. They don't get to pick their own dwelling. And when they move out, they do not get to keep the rental assistance and use it somewhere else. So the voucher stays with a specific unit. However, if a tenant remains in a PBV apartment for at least 1 year, they can request the next available Housing Choice Voucher from the Housing Authority, meaning that they could request a new voucher and choose where they want to live. To qualify for a project-based voucher is just like the previous policy that I talked about. You must be at least 18 years of age, be a U.S. citizen or an eligible immigrant, not exceed the income limit, and pass a background check. These two programs are very similar, except in the housing choice voucher, you are able to choose your dwelling and possibly even buy a home, as well as taking your voucher with you from one location to another. The project-based vouchers are assigned to specific locations only and are not transferable. Much of the housing innovation in recent years comes from the nonprofit sector, such as Habitat for Humanity. They've helped nearly 7 million people through home construction, rehabilitation, repair, or increased access to improved shelters. One big hurdle is how to handle the massive amount of the poorest people. They just lack the funding and the resources to handle all of the people that are of the poorest population. The scope and pace of building or renovating under nonprofits is inadequate to meet the need. The rapid rise in the price of land has been discouraging, and new construction has been declining. However, renovations have increased, but renovations don't house more people generally because they're just renovating units that generally are already occupied. In 1987, Ronald Reagan signed the McKinney-Vento Homeless Assistance Act into law and created more than 20 separate programs. A few of these are Section 8, HUD, which is what the other two programs are under. Emergency Shelter Grants Program, which provides block grant funding for emergency shelter and essential services. Supportive Housing Demonstration Program, which funds a variety of grants for transitional and permanent housing, particularly for those who have special needs or handicaps and homeless families. Shelter Plus Care, which incorporates supportive assistance targeted at homeless with mental illness or chronic substance abuse or AIDS. The Supplemental Assistance for Facilities to Assist the Homeless funds projects that meet the immediate and long-term needs of the homeless. And Single Family Property Disposition Initiative, which provides legislative authority to the HUD Secretary to sell or lease foreclosed single-family properties to nonprofit organizations or to state or local governments to provide temporary shelter for homeless people. Political views from the textbook. A few of the political views. The conservative critics argue that low-income housing assistance should be abolished, thereby allowing the law of supply and demand to regulate rents and eventually drive down prices. Free market economic philosophy suggests that as rents increase, demand will slacken and rents will eventually drop. Another argument is that government and housing should occur only by stimulation production of rental housing through financial incentives, such as tax breaks to builders, entrepreneurs, and investors. And liberal critics contend that because housing is a necessity and the demand is relatively idealistic, marketplace laws should not be allowed to dominate. A few questions. Are we doing enough for our homeless? Should we focus on specific populations? Should all house vouchers be transferable? And should all voucher recipients be able to choose their own dwelling? And there are my references. Thank you for listening.